Hello, everyone. My name is Lauren Kim, and I am a California state licensed acupuncturist and affiliated with St. Jude Providence Medical Group. I'm currently practicing in Fullerton and Irvine in Orange County, and I am also available at St. Jude Wellness Center in Brea as well. It's my honor to participate in this online workshop with you guys, and I hope this seminar can help you find out some valuable information about Eastern medicine. Today, I would like to share what you can expect from acupuncture treatment and herbal medicine to help clearing your pelvic floor disorders. Let me begin with a brief overview of how Eastern medicine diagnoses and understands the disease in general. Based on the fact that there were no available technologies in the past when Eastern medicine was originated, Eastern medicine diagnosis basically rely on the observation of the human body and interpreting manifestations by applying to our understanding of natural environment. Because Eastern medicine, the human body is the same as nature and is definitely a part of nature. Then repetitive observations of the similar or same conditions are categorized in certain ways. And it's the basic steps when any other scientific methods is initiated. However, unfortunately, in the past, it lacked further scientific methods, such as setting up an hypothesis or followed by scientific experiments to prove the ideas. So we're very lacking all this after steps of the scientific method after observations. We rely on observations, and traditional concepts of Eastern medicine categorize those observational symptoms following these main 8 diagnostic features. So the main thing is yin and yang. I think a lot of you already heard about yin yang theory. And then specifically, yin contains subcategories of cold, interior, and deficiency symptoms, which is generally a characteristic of static conditions. So nothing is moving, something very static, no such big movements involved. Compared to the yang aspects, yang contains subcategories of heat, exterior, and access, which has more kinetic characteristics of the nature. Yin, as you can see over here in this diagram, is the dark side of the circle, which is represented mainly by the night and the moon. On the other hand, yang is the bright side of the circle, represented by the day or the sun. So those are the 2 major natural observations that we can categorize into yin and yang. And then starting from that, these 2 colors are coiled around, fade into each other, and penetrate each other. So yin and yang sounds like very contradictory each other, but in fact, it's actually very complementary. It's not contradicting, it's complementary, and it's very relational aspects of 2 different natural phenomenon. Without one side, the other cannot exist. So yin exists because of the yang, and yang exists because of the yin. And then the harmony of mutual existence is the balance that can achieve the optimal equilibrium of the human health. Physiologically, when you are healthy, your yin and yang are balanced each other. Since we are all basically women in this workshop, most of us, women are considered yin and compared to the men. And many women's diseases, therefore, are related to the yin aspect of the body and tend to suffer from the yin part of the body. So such as blood or hormonal issues, there are more yin part of the body. And then women tend to be more deficient symptoms rather than access symptoms. And then also women tend to feel more cold than heat. And besides yin and yang theory, there's another theory that we see a lot when we're diagnosing the patient, which is like five elements theory. It resembles the natural elements. So five elements include wood, fire, earth, metal, and water. Depending on like which organ and which tissues or even emotions are affected to cause the symptoms, we can categorize and evaluate the patient and plan the treatment according to those five elements. So for example, when you are having a pelvic floor muscle weakness, that's the muscle is contained, it's part of the earth element. And then that is closely correlated with the organ, which is spleen and stomach. So when we are planning the treatment, we're targeting the spleen and stomach organ or spleen and stomach meridian. And we're selecting the herbs to benefit the digestive system. So we're talking about that a little bit more detail in the next couple of slides.
Hey, Lauren.
Yes.
I'm sorry. There's some noise going on. Are you in like a shared
Office.
space?
Yeah, I'm in the office. Is it like really noisy?
Yeah, it's a little bit. I heard some talking and some noises, and so I was.
Yeah.
Okay. I'm just wondering, I don't want to make you have to go back, but maybe we can pick up. I'm trying to figure out, do you mind going back? I feel bad, but like, we don't want to have a bunch of the noise in the session.
I know, like I'm in the office. My house is more noisy, so I'm in the office.
Yeah, no, that's fine.
I can't control the noise up there. I can use the conference room, but that's going to be quiet because there's nobody.
Yeah.
Then I have to set up I have to reserve the place.
Oh, okay.
So if that's the case, I don't think I can control it, like noises in this office. Yeah. Then I can do like maybe on Wednesday back again.
It's
too late?
okay. I mean, if you maybe, do you mind just kind of like, I hate saying this, I don't know how much time you have, but just kind of like re-picking up from the beginning a little bit and then just kind of move through it a little bit more. We can edit some stuff.
Okay.
I just like I was picking up noises, and I hate to have your presentation ruined because of the background noise.
Mm-hmm. So where should I go back?
Can you maybe just like finish? Just kind of like pick up like middle of where the yin and yang slide was, and then we'll just go from there.
Yeah. I don't know. What if the noise? There's a bell like constantly like ringing behind me. So
that's what I'm saying. I can hear that. Right now it seems pretty quiet.
Yeah, but it will come back. So I don't know. Should I just like go one slide by one slide? I don't know.
Yeah, I mean, you can continue on and I'll just stop you. Because like I said, we can edit this stuff together.
Uh-huh.
I just know that during this slide, I heard some talking and stuff.
Yes,
so
yes.
Just kind of describe this quickly and then move on, and then we'll go. Okay,
let me just go in the middle of here. I don't know if you can edit, you can edit it. And then I'll just like stop when the sound is there.
Yeah.
So I don't like keep
unless it's like real noticeable. But if it is to you, then go ahead and stop and say, I heard the sound. But anyways, just go ahead and we'll see what we can do.
Okay. So the tradition, can I go?
Sorry, yeah. Go ahead whenever you're ready.
All right. So traditional concept of Eastern medicine categorizes symptoms following these 8 diagnostic principles. Main thing is yin and yang. And yin contains subcategories of cold, interior, deficiency, and which has the characteristics of no movement or static condition. Whereas yang contains subcategories of heat, exterior, excess, which has more kinetic characteristics than the yin aspect. Yin, as you see in this diagram, is the dark side of the circle, which is represented as the night and the moon. On the other hand, yang is the bright side of the circle, represented as the day or the sun. These two colors are coiled around, fade into each other, and penetrate each other. And yin and yang sounds like they contradict each other, but in actual case, they're actually complementary rather than contradictory. Without one side, the other cannot exist. The harmony and mutual existence to balance can achieve the optimal equilibrium of the physiological status of health. I'll stop. Can you hear the bell?
Actually, I couldn't hear it that time.
Oh, okay.
That's okay. Just give yourself a little pause and then just pick up.
Okay, then I will just pass to the next slide, okay? After this bell, because I can hear the bell.
Oh, okay. Yeah, when the bell stops, just give yourself
I'll
like 5
continue,
seconds.
like, yeah. And then I'll do the page 3.
Perfect. Is it still going? I don't even hear it.
Yeah. Okay. So I'll keep on going. Besides yin and yang theory, anatomical or physiological aspects of the human body can also be categorized in 5 elements. 5 elements resembles natural elements such as wood, fire, earth, metal, and water. Depending on which organ or tissues or even emotions are affected to cause the symptoms, Eastern medicine practitioners can evaluate the patient and plan for the treatment according to those correlationship between 5 different elements. For example, when you have a pelvic floor muscle weakness causing, let's say like prolapse of uterus or prolapse of rectals, muscles is in the category of earth elements. And the organs that are correlated with this is stomach and spleen. So when Eastern medicine practitioners are planning to do acupuncture or like prescribe a herbal medicine, we probably are going to focus on the spleen and stomach organ and find the points that are benefiting those 2 organs, or find the herbal medicine which can tonify spleen and stomach organs specifically. I will talk about this later more in detail. So when we are talking about the pelvic floor, and then also majority of the patients that I see daily basis are coming because they have pain. And then pain relief is the main symptoms that most of the acupuncture providers are dealing with. And in fact, like most of the health insurances also cover acupuncture for any muscle or joint pain, such as like neck pain, back pain, or knee pain, shoulder pain, things like that. Likewise, when it comes to pelvic floor dysfunction, symptoms related to weak pelvic floor muscles, such as like incontinence, you have like fecal incontinence or pelvic organ prolapse, may also be accompanied by some kind of like pain, like stabbing pain or heavy pain or burning pain, and etc. So when we're talking about the pain is very subjective. So it is really hard to measure with diagnostic tools, or it's really hard to like observe pain in any test like an X-ray or MRI. So it's totally based on patient's individual description of what they feel and how much they feel with the pain. So during the consultation, it is very important for me to communicate with patients and pay attention to what they actually describe for their chief complaint and then the pain characters. So for example, we check like if the heat related with heat or cold, or does the pain gets better with the pressure or worse with the pressure, or how the quality of the pain is, it stabbing or dull, achy, or burning, and things like that. And then most of the time, description of the symptoms and pains are going to be resembled characters of external pathogens like wind. Like some people say like, oh, my pain is moving around, or it's cold. I feel like cold in the lower abdominal, or it's kind of like, it's kind of heavy and there is like discharges that are like very thick, like a dampness in the natural environment. Or sometimes people say like it's dry, it's lacking like water aspects of the body, it's very stiff and dry and itchy. Those are like dry condition of the pain. And then sometimes it's very like burning pain when it comes to the inflammation, and if there is any like infections from the outside virus or bacteria. And then if the pain is related to any like gynecological issues, we also check with the blood quality or quantity during the menstrual cycle. So we check what's the color, how does it smell like, and then those are also like a really good clue to evaluate the patient and then diagnose the patient based on their description of the pain. And then also like if it's acute or chronic, or is there anything that relieves the pain like ice pack, or sometimes a heat pad helps the pain, then those are all like the descriptions and how the patient is dealing with the pain. It's a really good clue for us to determine the diagnosis based on the 8 diagnostic principles, and also like 5 elements theory. So as I mentioned in the previous slides, Eastern medicine diagnosis has been structured based on the observation and sorting out meaningful clues into categorization. So we need to find out what causes the imbalance, and then we got to know like what are the signs and symptoms and descriptions and how you feel actually with the pain. So like I mentioned, a lot of times people say like stabbing pain, and that tells us, oh, there's a blood stagnation. And then when they say it's heavy, swollen pain, that tells us, oh, there's some type of dampness in your meridian or organ. And then if there is any moving pain, there's a chi stagnation, or if there is any dull, achy pain, we can kind of like assume that the patient has a blood deficiency. So a lot of descriptions tells a different diagnostic terms. So it is very important for us to communicate with the patients every visit to kind of like better plan out the treatment, and then to clear the symptoms. Okay, so like now let's move on to like 3 different treatment methods you can expect from Eastern Medicine Clinic, which is acupuncture, herbal medicine, and Moxibustion. It's a very large topic since pelvic floor disorders can include so many different symptoms, but I'm not going to go with too much detail on specific symptoms or diagnostic diagnosis, since I mentioned in the beginning, it does not give me so much difference in Eastern medicine diagnosis treatment, because like no matter what specific diagnosis name you are labeled with your symptoms, many symptoms are considered just as pieces of puzzles for the big picture for me to determine which 8 features and 5 elements you are belonging to. So then same diagnosis can be treated for different approaches, or different diagnoses can be treated with the same approaches. So it doesn't really tell too much information for Eastern medicine provider, the Western diagnosis terms. So when you are in the Western Eastern medicine clinic, the diagnosis name can help us to kind of imagine like what like pathological process that you're going through, but also it's really, we need to know like how you feel and what you present with your pelvic floor disorders. So first, I would like to go over very basic anatomical structures of the pelvic floor with a simple image. This will help understand how acupuncture and Eastern medicine diagnosis will fit into pelvic floor disorders in the next slides. So there are like pelvic floor muscles in the middle, which is, like I mentioned before, it's belonging to the earth elements and then correlated with the spleen and stomach organs. And then pelvic floor dysfunctions are usually correlated with the pelvic floor muscles, which has enabled to relax or coordinate with other muscles around. And then because of that, blood vessels or nerves passing through that muscle will be affected and causing any other like pathological changes in the body. And then in Eastern medicine, there's a really good concept called chi, which is a biological energy. And then chi is very important to hold all the organs and muscles in place. So organs that are sitting on the pelvic floor muscles that includes like bladder, uterus, and bowels. And then we're going to go through the meridians that are passing those three different organs. And then consider those organs dysfunction that will be manifested as a symptoms and signs that you are suffering because of your pelvic floor disorders. And then based on that 8 diagnostic principles and 5 elements, we're going to determine whether you're going through any deficiency type symptoms or excess type symptoms. And then based on that, we're going to find a acupuncture points and then the herbal prescription that are going to be best fit to clear your specific symptoms. So acupuncture is basically works within the meridian system. And then I would like to go over like what type of meridians are passing through pelvic floor and what kind of acupuncture points might help with the pelvic floor disorders. So most people get the idea that neck pain, lower back pain, or any other muscle pain can be helped with the acupuncture simply because like you can insert needles to that specific problematic muscle directly. But pelvic floor muscle is like deep inside internally. So we cannot really reach to the pelvic floor muscle from the outside with the needle. So we have to go with the meridian system and then target the meridians that are passing internally through the pelvic region, as well as those 3 major organs on the pelvic floor. So acupuncture needle will go into the acupuncture points that are situated in the meridians. And meridians are usually the network of essential substances that are chi, blood, or body fluids are flowing throughout the body. So it's like a giant web of pathways. It's like a freeway, but it can reach out to like every single point of our body system. And then they are like intertwined each other very organically and they're related to each other. So in the healthier condition, it maintains the balance and it loses the balance in a pathological status. So when you're sick, there is some imbalance in the meridian. And then acupuncture is definitely to regulate the flow within the meridian system. So kind of like recover that equilibrium and recover that balance that are broken down in the pathological status. So there are like distributions of meridians looks like distributions of blood vessels or nerve innervations. There are like meridians that are flowing vertically internally or there are meridians that are branched out and then running horizontally, branched from the vertical flow. And the acupuncture points are like situated on that different meridians and have a different actions for each point. And then there are also like extraordinary meridians that are not particularly related to the internal organs, but it's like going through a variety of organs all together so they can link different organs in one meridian system. So I'm going to go over like meridians that can be helping for the pelvic floor region to transport the qi and blood to the pelvic region and moisten and then nourishing the body, and then responding to the dysfunctions if there is any pathological issue. And then if there is any like infections or inflammations going on, we want to stop like distributing those infectious diseases throughout the whole body system. So we're going to stop that by selecting the right point for that. So in this diagram, I want you to focus that there is a 12 different meridian systems, and then each meridian system has a different directions. There's an upward direction or there's a downward direction. And then we want to focus on the upward direction for the pelvic floor disorders, because usually pelvic floor disorders correlated with the pelvic floor muscle prolapse, which will dragging down the muscles and then the organs that are sitting on the pelvic floor to the downward direction. So if we want to tighten it up and then like push all the direction towards up, some of the prolapse symptoms can be cleared by redirecting the meridian flow. Was it noisy?
I didn't hear anything.
You didn't hear anything?
No, it sounded okay over here.
Okay.
So I would just say give yourself a couple seconds and then just pick back up.
Yeah, I'll just keep on going with this kind of sound, background sound. Okay. So there are a couple of meridians that are related to the pelvic organ, because like through the meridian system, they're passing around the pelvic floor and lower abdominal area. So first meridian is like, it's the spleen meridian, and then those are the in channel. And then there is always the pair of yang channel, which is a stomach meridian. So spleen and stomach is like a front and back of the coin that are going together. And then when you see the spleen meridian, the direction is going towards the up. So stomach meridians goes down, because imagine when you're eating food, the stomach is the one who's going to transport the food from the mouth all the way to the stomach, and then spleen is the one who's using those valuable like nutrients or essences that are digested from the digestive tract and then disperses to other organs for the usage. So the spleen is a very important organ to hold the organs in place. So when we're saying like if there is any like downward direction, like your energy flow goes down, you feel tired or you feel fatigue, or you're having like hemorrhoids or like uterine prolapse, those are like the indications that your energy flow goes downward instead of going upward. So in that case, spleen is the major organ that we want to target. And then usually like spleen 9 or spleen 8 or spleen 6 points, you can see it in the diagram. They're all situated below the knee points. Those are the main acupuncture points that where we put the needles to help like different situations that are related with the spleen meridian. And then there is like a pair yang channel, which is the stomach channel. And the stomach channel is connecting with the spleen, and then it passes the inguinal region. So we want to check that point as well when it comes to pelvic floor issue. And then we might select like stomach 30 points that are in the inguinal area, or stomach 36 points that are below the kneecap, which is like a major points for the chi and then the blood tonics. And there's another major meridian, which is the kidney meridian and urinary bladder meridian. So it's the same thing as stomach and spleen. That's our yang and in pair channel. And then as you can see, kidney and bladder meridians are running through the midline of the body, and then that connects the front and back of the body. So the spine, and then also it connects with the kidney and bladder. So if you have any issues with the pelvic floor, and then that creates any like urinary problems, those are the meridians that most of the acupuncturists will go for it. And then also those kidney meridians are related to other extraordinary meridians, which is like governing vessel and then the conception vessels. Those are like front and back of the body. So that's like a key meridian that we might want to tackle when it comes to the pelvic floor issue. And then those are another extraordinary meridian. There are, besides like 12 regular meridians that are closely related to each organs. Those are the extraordinary meridians that are connecting main meridians and touching those organs that are not included in as a major organ in acupuncture theory. So when you see like the left side, it's running through the midline of the body. Those are called conception meridian. And then those are very like main meridians that we use for the female productive system. So when you have any like uterus or like gynecological issue, those are the main meridians that we're going to use it for acupuncture, or like maybe we can use it for like Moxibustion as well. I'm going to talk about the Moxibustion in the later slides. So just know that those are very important meridians for like women's disease. And then there is another meridian called the governing vessels that are like going through from the umbilicus and then like wrap around the pelvic floor, and then going up to the kidney, and then all the way go to the brain. So that point, especially the governing point 20, it's on the top of the vertex of the head. Those are like number one points when we want to drag all the chi and blood flow towards the up. So do 20, which is a governing vessel point 20, is basically used for those symptoms that are like dragging down like a prolapse. And then another two extraordinary meridians are very useful for pelvic floor issue, because as you can see in the diagram, it also like connects the pelvic region front and back. And then it regulates the female reproductive system. And then it connects also with the kidney channel, which is like on the left side, it's a penetrating vessel. So it penetrates basically a lot of meridians, and then it penetrates throughout the whole body and distributing the blood mainly. So this is the very important channel that we can use it for female reproductive issue. And then the right side, the diagram, it shows the girdle channel. Girdle channel is the only channel that wraps around horizontally. So all the other channels are going up or down vertically, but this is the only main channel that goes around the waist area, and it works as like a belt. So when there is any like disorders of the organs that are not in place, then the girdle vessels will kind of like belt around and tightening all those organs in place. So when you're having having like pelvic floor weakness, probably the girdle channels are stimulated, then you will have more power to tightening those muscles to back into the original place. Now I'm going to move on to like herbal medicine. And there are like so many herbal prescriptions out there that we can use based on your 8 principle diagnosis and 5 elements diagnosis. But I'm just going to introduce like 4 major herbal prescription that might be used for the pelvic floor disorders. So when we're prescribing the herbal medicine is not just a single herbs that are formed into the medicinal form. It's actually the cocktails of different combinations of herbs. So it's not just a single herb. Mainly, it contains like 6 to 10 different herbs together to action together in one whole prescription. And then when we're like combining different herbs together, we always have to think about like axis type or deficient type, heat type, and cold type. So you don't want to pour like extra thing on the axis status. So we want to know and differentiate axis from deficiency and deficiency from axis. And then for the heat and cold as well, you don't want to put more heat when the person is suffering from the cold type. So we got to differentiate whether it's a real heat or is it heat because something is not controlling the heat, which is called like deficiency heat. So you can have a heat symptoms when you actually have like extra heat in your body, or you can have a heat symptoms if you don't have enough water to control the heat. So in that case, we call that deficient heat. So like when you have excess heat, you just need to pour and extinguish the heat by using the cooling herbs. But when you're in deficiency heat symptoms, you have to pour more water. You're not just going to extinguish the fire. You're just going to pour more water and then control the fire. So your heat symptoms to be cleared. So it is really important for Eastern medicine providers to determine which way to go to clear what you are suffering from. So the first herbal medicine that I want to introduce, it's called the Puzong Ichi Tang, which is mainly used for any spleen qi deficiency or downward problem like uterus prolapse or rectal prolapse. And then on the right side, I show like, different type of herbs that are combining together in this specific cocktail. So this whole combination of herbs together will tonify spleen and tonify qi, and then that can be help for any prolapse symptoms if you have any from the pelvic floor disorders. And then the other one is Ba Wei Di Huang Wan, and which contains like 8 different herbs in it. And then it is used for like bladder hyperactivity, and then like overactive bladder or any urinary bladder issues because of the pelvic floor. And then if you have any like kidney deficient symptoms, this is the main herbs that we can go for it. So it will tonify kidney yin and kidney yang, so it can clear both heat and cold symptoms together and tonify both yin and yang aspect. So people who are suffering from both symptoms combining together, then this is the herbs that we might be able to consider to prescribe it to the patients. And then the next herb is called Xiao Fu Zui Tang. And those are mainly used for any like lower abdominal pain, which is caused by qi or blood stagnation. So it's basically the painkiller for any lower abdominal region. So this research shows that this particular herbal prescription was very effective for the endometriotic lesions in a rat model. Well, it's not a human research, but it has a very good result to see that endometriotic lesions are cleared with this specific herbal decoction. And then those are like the ingredients that contains within this particular herbal cocktail decoction. And then the last one that I want to introduce is called Guozi Fuling Huan. And then I use in my clinic a lot for people like female who has like menstrual issues. So if you have like very bad menstrual pain, or if you have any diseases that are related to the uterus, then this is the herbal medicine that I go for it. And then the research shows that it is very effective for like chronic pelvic inflammatory disease. So any like blood stagnated, causing abdominal pain, and then if it's related to the pelvic region and then uterus region, Guozi Fuling Huan is good for to clear those symptoms that you're suffering. So lastly, I would like to introduce the Moxibustion, because Moxibustion is a very effective treatment tools that we can use in an Eastern medicine clinic. And then maybe like some of you are heard about it, or like most of you are not really know about Moxibustion, but this is a very powerful method that we use. And Moxibustion is similar to acupuncture, but it is a little different because we're using the thermal aspects of the stimulants by burning the herbal materials, such as like mugwort. That's the main herbs that we use for the Moxibustion. And then we put the mugwort powder, or like Moxibustion stick onto the acupuncture point to tonify or warm and nourish the meridian system. So it activates the blood and dissolving, if there is any stasis, we dissolve that. It promotes qi and it relieves the pain. And then also it is a heating method. So if there is any like cold symptoms, the Moxibustion is very effective treatment tool that we can use to expel the cold and promote the circulations of the meridian, and then like clear the pain that comes with the cold. So mostly we use it for arthritis pain, joint pain, any lower back pain, or any like infertility or cold diarrhea, fatigue, or dysmenorrhea, abnormal uterine bleeding, prolapse, and sometimes we use to breech the baby in a full term. So Moxibustion is not common, but it's really good for any like lower abdominal symptoms that usually the female can suffer from. So those are the three main treatments that I introduced today: acupuncture, herbal medicine, and Moxibustion. And then I hope you have a useful information, and then determine what you can go for it to help your pelvic floor disorders in the future. We got some couple of questions that people have for acupuncture treatment. So I'm just going to touch base like 2 questions that most of the people are wondering about. And first one is like the patients were asking me like how you can initiate the acupuncture treatment. Do I need a primary care physician's referral, or do I need to bring like blood test results or any other like MRIs or X-rays before you come into the acupuncture clinic? So I will answer that question. Depending on your insurance, actually, you might not require primary care physician's referral to get into the acupuncture treatment. So the best way is you can contact our office, and then our office insurance specialists, that they are very good at verifying your insurance and then direct you whether you need a primary care or a specialist referral to acupuncture treatment or not. So it really depends on your insurance. And if you have any like PPO plans, or if you're just a cash patient, you can just, call to our office and then make an initial appointment without any referral. And then when it comes to like blood tests or hormone tests or X-ray or MRI, if you can bring it in, yes, it will help me to understand your symptoms and what you're going through. So definitely it will help me. But if you don't have any test results, it is totally okay to start acupuncture treatment without any like Western diagnostic tools, because like I mentioned in my slides and workshop, I go basically on with your subjective description of your symptoms and signs. So Western diagnosis will help me, but it's not like I cannot start treatment without any test or without any like specific diagnosis. So that could be a general answer for the question. And the next question that people were asking is, how many sessions do I need to see the results with the acupuncture? That's very like most of the new patients are asking me, how many sessions do I need to come? So it really depends on how your symptoms has been before and how severe your symptoms are. Is it chronic? Is it more than a couple of months or a couple of years? Or is it something just happened? Or is it how severe you're at with the symptoms? So it really depends on individual to individuals. And then also it can affected by any underlying issues that you have, any other health issues on the top of your main symptoms. So it really depends on individual, but I would say like 6 to 8 sessions to try, and then it will vary how much you feel relieved, but you will see the difference between 6 to 8 sessions. Then it's worth to keep trying acupuncture treatment to get your symptoms go down with the pain level or go down with the discomfort. And then the final question is about the insurance that a lot of people were asking. Is insurance cover for acupuncture? Not all the insurance will cover acupuncture treatment, but most of the insurance are covering acupuncture recently. And then I am affiliated with St. Jude Medical. So if your HMO plan or like St. Jude Medical approves your treatment for acupuncture, yes, we can take most of the insurance through referral or without referral, depending on the plan benefit. And pain specifically can definitely covered by insurance. And if you have any other symptoms besides pain syndrome, then some of the insurance will not cover for it. So if you want to know about more detail about your insurance coverage and your symptoms, you can contact to our office and we can briefly go over your benefit plans and your symptoms that you want to be treated with the acupuncture. Then we can direct you more specifically. So I think that's about the questions that most of the patients have for acupuncture treatment. And if you have any further questions, you can email me or you can contact to our office. My email address is laurenkim.lac@gmail.com. laurenkim.lac@gmail.com, or you can contact our office at 714-773-7000. Thank you.